Welcome to the Children's Health and Education Mapping Tool. I'm going to share 12 basics for getting it started with the tool. Follow my cursor and I'll walk you through 12 easy steps. The first thing that you're going to do when you open the tool is select a state. We've selected the state of Georgia. Now let's say you want to view the data that you've selected to include in the tool. If you click on this icon here, you can download and view a table or download to Excel all of the data that's in the tool. If you'd like to zoom in or zoom out, you can use these buttons here to do so. Now, let's say you want to identify counties underperforming compared to national averages on powerful indicators of need. You can use the Children's Health and Education Indicators layer to add to the map information about health insurance and coverage, health indicators like teen birth rate, percent obese, and the percent food insecure, the chlamydia rate. You can add education indicators, and you can also add demographic and socioeconomic indicators. You can use these information buttons to view indicator definitions and data sources. When you select an indicator to include in the map, the indicator will automatically be set to the national average. These sliding balls show you the national average for each of the indicators. So if you're looking at the adult percent population, percent obese, the national average is 28%. The tool will show you those counties underperforming compared to the national average on this indicator. As you add multiple indicators to the tool, the counties in darker gradations of blue are the counties underperforming on more indicators. Next, you can view the locations of school-based health centers and schools. Here, you can view characteristics of SVHCs in schools. For example, you can view school-based health center sponsor types, provider team types, school-based health centers that are using telehealth, SVHC hours of operations, and filter them based on these criteria. You can use other filters, for example, Title I eligibility or free school lunch eligibility, if you click on schools to filter schools. Let's say you want to add your own data to the map. Click here on the icon next to number 7. For example, if you wanted to view the locations of mental health agencies in relation to school-based health centers or schools, you could add that data here. In optional layers, you have the opportunity to add other data to your tool. For example, if you want to add the locations of hospitals, federally qualified health centers, rural health facilities, congressional districts, this type of information can be added in the optional layers here next to number 8. If you select base maps at the arrow next to number 9, you can select different background map styles. Next to the arrow number 10, you'll see the high needs identifier. Use this tool to identify counties who are underperforming on one or more indicators. You can select up to 11 indicators to include in the map, and this tool will allow you to identify and isolate those counties underperforming on different numbers of indicators. Here, you can view a legend, or you can view a list of selected indicators and facilities. Finally, if you'd like to print your map, click here on Print, and you can download and print what you've created. If you have questions, please reach out to us at research@sbhforall.org, and we'd love to help. Thank you.